Hello and welcome to my YouTube channel. Today I'll be looking at a very important aspect of our lives called vital signs, vital for life. When you hear the word vital, what comes to your mind? Something that is indispensable, something that is essential, something that is necessary to the existence of something. So, these vital signs that we're going to be looking at today are crucially important. Although not all these are done every time we get to the hospital, but I've included a number of these because they're really very important. And if we can pay close attention to them, it's going to make a whole lot of difference in our lives. So we start from the dashboard of your car. When you look at the dashboard of your car, you're seeing the speedometer, you're seeing the oil gauge, you're seeing a number of things. And essentially, these things are there to guide and help you understand when there is a problem going to arise. And so, signs simply point in the direction of something. So, also, God has designed our bodies to be able to give signals or signs when something is going amiss. So, what are vital signs? They're clinical measurements, they help to assess physical health, general physical health. They also indicate possibility of the presence of a disease. So they're pointers towards something going on. And then they're also crucially important in monitoring whether there is an improvement or a deterioration where there is a disease state. So we start with the pulse rate. Usually, the pulse rate will range between 60 and 100. It's important to mention that these values, as much as they have a wide range, they're not um, such that if there's just a single digit outside them, it becomes so much of a problem. So you don't go into unnecessary apprehension. For example, you check your pulse and it's 59. That doesn't essentially mean that something sinister is going on. It could just be for a few moments and then later it will regularize. So 60 to 100. Now, if it is below 60, it could indicate a problem. But that's where a doctor needs to assess to know whether there's truly a problem or it's just something that's going to be there for a temporary period of time. If it is above 100, what we call tachycardia, it means that your heart is beating too fast, and that could indicate a problem. Of course, if you've just climbed the stairs, your pulse rate could be higher than 100. That doesn't mean that there's something wrong. It just simply means that the body is compensating for the amount of effort you put in, and so the heart is pumping faster than it should or normally does. Now, I've singled out a particular category of persons, say athletes or people that are into a lot of exercise, muscle building, and all that. Essentially, what happens is that because they are doing that, the heart compensates for that. And so these people would typically have pulse rate that are slightly lower than normal. So if you see a professional athlete, the person's heart rate or pulse rate, which we also call pulse rate, could be, say, 50, 55, sometimes lower. Doesn't mean that there's anything wrong. It just simply means that the heart has compensated. The heart is able to pump a larger amount of blood than regular people, so doesn't need to pump that fast. Secondly, blood pressure. Even though we say that the optimal blood pressure is 120 over 80, it doesn't mean that everybody's blood pressure should be 120 over 80 to be normal. These variations exist. Now, it's important to mention that usually, before a doctor commences blood pressure medication, the blood pressure should be somewhere consistently above 140/80. But there are some variations to these. If a patient is diabetic and say has a renal problem, we do not expect that we don't expect doctor to wait until blood pressure is above 140/80 to 90 to commence medication. The blood pressure medication may need to be commenced at a lower level than 140/90. Temperature. Please be aware that there could be slight variations in these figures quoted in this video. Usually 36.1 to 37.2. If it's lower, we're talking about hypothermia, in other words, body temperature lower than it should be. If it is higher, we're talking about things like hyperthermia or fever. These variations indicate that there's a problem that requires attention. Respiratory rate could be between 12 and 18. If you're breathing too fast, there could be a problem. If you're breathing too slowly, there could be a problem. So essentially, it's a case of too much of everything is bad, and too little of everything could also be bad. Body mass index. The normal body mass index is between 18.5 and 24.9. It's easy to calculate this, and if you don't want to go through this mathematics I've written here or arithmetics, you can just simply put in these figures into a BMI calculator and it will give you your value. But the calculation is very easy. It's simply the weight in kilograms divided by the square of your height in meters. So simply check your weight, record it, check your height, record it. So for example, if your weight is 100 kilograms and your height is 1 meter, the calculation is simply 100, which is your weight, divided by 1 times 1, that is the square of your height. And that value will come to 100. If this is so much of a problem, simply put those values into a calculator and it will give you your figure. The point is that we need the BMI to be between 18.5 and 24.9. If it is below 18.5, it means that your weight is too low. If it's above 24.9, it means that your weight is too much. Now, I've used the weight primarily because you really can't do much about your height. It's really the weight you can do something about. Now, I've not talked about another measurement that we can do. We can leave that for perhaps another video. But the BMI, even though could have limitation, it's very, very helpful in assessing the relationship between your weight and height. Oxygen saturation. Now, the pulse oximeter has a sensor that helps to determine your oxygen saturation, which is simply the percentage of hemoglobin in the blood that is saturated by oxygen, with oxygen. Usually, this should be between 95 and 100, but please note that there are some patients, particularly patients that have a condition called COPD, that's chronic obstructive pulmonary disease, that do not necessarily have to have their oxygen saturation as high as this. It's important that this is mentioned. Then blood glucose ranges again, remember, be some variations. We talk about the fasting blood glucose, and then the random blood. Fasting blood glucose is simply the measurement that is taken before breakfast. And then the random blood glucose is the one that's taken after you had breakfast. These values could be slightly different, but it's important to mention that there could be slight variations in these. So what do you do? I know you may say, I'm not a doctor, but there's something you can do. Number one, you can check your blood pressure today. And you don't have to learn how to use what we may use in the hospital, which is the mercury type. You could have the simple one that is sold in the pharmacy, where you could simply wrap it around your arm and it will give you the values. It will give you your blood pressure, it will give you your pulse. That you can do today. You could also check or calculate your BMI, as your body mass index, and simply do something about that if it is out of range. You most likely unlikely to be able to do something about your height, but you can do something about your weight and bring your BMI down. If you've learned something today, thank you, and please do subscribe. I'll see you again